Hi, my name is Dr. Mark Anthony Shepard, and I'm one of the co-founders here at Smile Genius Dental. And I just wanted to cover what every patient should know before starting a line of treatment. This is a very important topic, just to help for a few reasons. Firstly, is just to ensure that your patient knows exactly how to perform their treatment, so that they're not messing up and coming back to you with unnecessary questions about things that they should have known from the beginning. And I see this quite a lot with patients who come into me from other dentists or other aligner companies, and they just mess up their treatment by just not wearing their aligners long enough or just not following certain instructions. So the main point is to improve compliance. By improving compliance, you can improve the predictability of the movements by allowing the patient to do the treatment correctly. And when you increase predictability, you improve the results, therefore reducing the amount of refinements. And refinements reduction is really good because that stops you from having to pay unnecessarily and wasting time printing additional aligners at the end of treatment. So I tell my patients three fundamental points. First is the two fundamentals of dentistry. Second is the aligner wear cycle and treatment cycle, which is important to let your patient understand how to perform their treatment and what to expect. And finally, it's just answering some frequently asked questions early on in treatment. So two fundamental things to tell your patients is firstly to wear their aligners for the prescribed time. 18 to 22 hours is the most important thing, so that they understand that if they don't wear the aligners for that time frame, they may not get the results they're looking for. So it's very important to stick to that. Also, the second thing would be to look out for a perfect fit. And I always tell my patient that the better the aligner fits, the better the process works. And this is so true because a lot of times patients who fall off or mess up their treatment, they're not looking at their aligners. They think it's just wearing the aligners and that's it. But it's a matter of actually looking how well the aligner fits over their teeth before switching from one to the next and how it feels, so there's no pressure on their teeth. So the aligner wear cycle, the way I explained it, is that they're going to experience a tight phase for the first week, and at that point I want them to start at nighttime so they can wear the aligners for more consecutive time. The aligners are going to feel tight at that stage, and they're going to use their chewies for a couple times a day, which I tell them this is the most important thing, to use the chewies to help stimulate a good fit and stimulate blood from the jaws. After the tight phase, the aligners are going to start to feel loose, where the patient is just going to use the chewies as they need to if the aligner is not fitting perfectly snug over the teeth or there's still pressure. And as they're changing aligners, this is the most important part as well, to ensure that they understand to inspect their aligner fit to make sure it's perfect. And then if it's perfect, then to change aligners and then to check in with you by sending photos. You can even train your staff how to check photos to ensure that the aligner is fitting perfectly. And if they see incisal gaps, to just let you know so you can address that. And to let the patient know that if they don't see a perfect fit with their aligners, not to change it, and instead to use their chewies for an extended period of time and to contact you so that you can take action and correct the tracking. Now, the treatment cycle is just important to explain to the patient that there's going to be a primary stage of treatment where they're going to complete all their initial aligners and they're not going to eat or drink with the aligners on and keep their teeth super clean. Next, to explain that if the results were not met completely, that they're going to have refinements to print additional aligners at the end of treatment just to get their results exactly the way we prescribed. But a trick that I do is I tell them that if they don't check in regularly throughout the entire treatment process, that there will be a cost for refinements. And a lot of the times that is what helps really to get them to check in on time and improve compliance. And finally, explain to them that there will be a retainer that they will wear indefinitely after treatment, especially for a few months after they've gotten the results, so that their bones can heal. Very important. Next thing is just answering a few FAQs. Now, I like to have an instruction guide as well that I use with my treatments so that they can follow closely and read that before they start treatment so they don't have any questions. But I always explain in the clinic that there may be a little bit of discomfort. Also, they may experience a slight lisp with their aligners, and to keep their aligners protected and not throw them away, which is very important. So how can you accomplish all this? The way I like to do it is I use Smile Genius. It's really good. It gives the patient very clear instructions. It also allows you to upload your own resources like aligner guides, videos, so that the patient can just download those automatically. It sends the patient automatic change notifications so they can change their aligners and then take photos through the app so they can send it to you. And then you can evaluate the progress images. Now, if they have questions, you can reply to the patient through the chat and video function, and that will help you to troubleshoot early and then accomplish a much more seamless treatment experience and really get the result that you want right away without using as many refinements. Okay? But that's it. If you have any questions, let me know. Thank you very much. If you want to experience Smile Genius, let me know and book a demo. You can email us. Have a great day.